Have you ever looked at your arms in the mirror and felt that quiet shock? That soft, sagging skin that seems to appear out of nowhere, even if your weight hasn't changed. Most people assume it's just fat. But what I'm about to tell you might surprise you, because in many cases, it's not. Before we go any further, if you care about your health and want to understand what your body might be trying to tell you, take a second to like this video and subscribe. I'm here to help you notice the signs most people miss before they become bigger problems. Now let's talk about what's really happening. I've seen this happen too many times. A patient comes in, frustrated, even embarrassed, telling me they've been dieting, walking, trying everything, but their arms still look loose, weak, almost fragile. They think they're failing, but the truth is, their body is signaling something deeper. Saggy arms are often not just about fat. In fact, for many adults over 35, it can be a subtle warning sign of muscle loss, something we call age-related muscle decline. And it doesn't happen suddenly, it creeps in quietly. You don't notice it at first, until one day your strength feels different, your skin feels thinner, your arms don't respond the way they used to. And here's the part most people don't realize. This process can begin earlier than you think, sometimes in your late 30s or 40s, and it accelerates if your lifestyle isn't supporting your muscles and metabolism. What worries me is that many people focus only on weight. They look at the scale and think everything is fine, but the scale doesn't tell you what you're losing. You could be losing muscle while your body holds on to fat, and that combination is what creates that sagging appearance. But it's not just about how your arms look. This kind of change in your body can be linked to reduced strength, slower metabolism, and even changes in how your body manages blood sugar. Yes, something as simple as sagging arms could be connected to deeper internal shifts. And I want you to understand this clearly. Your body is not working against you. It's trying to communicate with you. The question is, are you listening? Because what we're about to uncover might completely change how you see your body, and what you do next could make a meaningful difference. What I'm about to tell you might change the way you think about your body forever, because that softness in your arms may not be about how much fat you have, but about how much muscle you've quietly lost. Most people don't realize this, but after the age of 30, your body naturally begins to lose muscle mass. It's a slow process at first, almost unnoticeable. A little less strength here, a bit more fatigue there, but over time, it adds up. And one of the first places it often shows is in the arms. I've seen patients who look perfectly normal on the outside. Their weight hasn't changed much. Their routine hasn't changed much. But when we look closer, their muscle quality has declined significantly. And that's when the arms start to look loose, soft, and less defined, even if there isn't much fat there at all. And here's something that often surprises people. Muscle isn't just about strength or appearance. It plays a critical role in your overall health. Your muscles help regulate your metabolism. They support your joints. And importantly, they play a role in how your body handles blood sugar. When muscle mass decreases, your body may not use glucose as efficiently. Over time, this can contribute to higher blood sugar levels. That's why I often tell my patients, don't ignore these early physical signs. They may be subtle, but they matter. Now think about your daily routine. Are you spending long hours sitting, maybe at a desk, or watching TV in the evening? Are your arms mostly inactive throughout the day? No lifting, no resistance, no real challenge to your muscles? Because if that's the case, your body adapts. It starts to conserve energy. It lets go of muscle that it thinks you no longer need. And this doesn't just affect how you look, it affects how you feel. You may notice your arms getting tired more easily. Tasks that once felt simple, carrying groceries, lifting objects, start to feel heavier. And slowly, almost invisibly, your body composition shifts. More fat, less muscle, lower tone, less support under the skin. That's when the sagging becomes more noticeable. Not because fat suddenly appeared, but because the structure underneath has weakened. But here's the important part. This process is not something you're powerless against. Your body is incredibly responsive. Even small, consistent changes can help support muscle health, improve tone, and make your arms feel stronger again. The key is understanding what your body actually needs, not what trends or quick fixes promise. Because the real solution isn't about starving yourself or chasing numbers on a scale. It's about rebuilding what your body has been quietly losing. Now, here's where it gets even more interesting. Because muscle loss is only part of the story. What I'm about to tell you might surprise you. The skin itself is changing too. Most people don't realize that your skin is not just a covering. It's a living, active organ that depends on internal support. Underneath that skin, you have a network of proteins like collagen and elastin. These are what keep your skin firm, smooth, and resilient. But as you age, your body naturally produces less of these proteins. And I've seen this happen too many times. Patients focusing only on fat loss, completely unaware that their skin is losing its ability to bounce back. So even if they lose weight, even if they're doing everything they think is right, their arms still look loose. Because the issue isn't just what's underneath the skin, it's the skin itself. Collagen begins to decline steadily after your 30s. Elastin, which helps your skin snap back into place, also weakens over time. And when these changes combine with reduced muscle mass, the result is exactly what you see in the mirror: sagging, thinning, and a loss of firmness. But there's something else that often gets overlooked: hydration. Not just how much water you drink, but how well your body retains and uses it. Dehydrated skin tends to look thinner, less elastic, and more fragile. And in many adults, especially as metabolism changes, the body becomes less efficient at maintaining proper hydration at the cellular level. So even if you think you're drinking enough, your skin may still not be getting what it needs. And then there's nutrition. Your body needs specific building blocks to maintain muscle and skin health. Protein, certain vitamins, and essential nutrients all play a role in supporting collagen production and muscle repair. But many people, especially as appetite changes with age, don't get enough of these nutrients consistently. I often ask my patients a simple question: are you feeding your body what it needs to rebuild? And the answer is often no. Not because they don't care, but because they were never told how important this is. So when you see sagging arms, it's not just one issue. It's a combination of muscle loss, skin changes, and nutritional gaps working together over time. And here's the part that really matters. When you understand this, you stop blaming yourself. You stop thinking you're doing something wrong. And you start realizing your body is asking for support in very specific ways. The good news is, when you respond to those needs correctly, your body can begin to improve. Maybe not overnight, but in ways that are real, noticeable, and meaningful. And what we're about to talk about next is something almost no one pays attention to, but it can quietly make everything worse if ignored. There's one factor I want you to pay very close attention to, because most people overlook it completely. And yet, I've seen it quietly accelerate the exact changes you're trying to avoid. It's your daily movement, or more importantly, the lack of it. What I'm about to tell you might surprise you. You could be exercising, even walking regularly, and still experiencing muscle decline in your arms, because general activity is not the same as targeted stimulation. I've seen this happen too many times. Someone tells me, "Doctor, I walk every day." And that's excellent for heart health, circulation, even mental well-being. But here's the truth. Walking does very little to maintain the strength and tone of your upper body. Your arms need resistance. They need a reason to stay strong. Without that, your body begins to adapt again. It prioritizes efficiency. It slowly reduces the muscle fibers in areas that aren't being used. And over time, the arms become weaker, softer, and less supportive under the skin. Now think about your typical day. How often are you actually using your arms in a way that challenges them? Not just light movements, but real engagement, lifting, pushing, pulling, even small forms of resistance. For many adults, especially with modern lifestyles, the answer is very little. And here's where it becomes even more important. When your muscles aren't being used, your circulation in those areas can also become less efficient. Blood flow plays a role in delivering nutrients and oxygen to your tissues. Without proper circulation, your body's ability to repair and maintain muscle and skin can slow down. It's a subtle effect, but over time, it contributes to that same pattern you've been noticing. Less tone, less firmness, less resilience. But I want to be very clear about something. This is not about intense workouts or extreme routines. You don't need to spend hours in a gym or lift heavy weights to start making a difference. In fact, I often encourage my patients to begin with very simple, controlled movements, the kind that are easy to stay consistent with. Because consistency is what your body responds to. Even light resistance, when done regularly, can send a powerful signal to your muscles. It tells your body, we still need this strength, and your body listens. Over time, this can help support muscle tone, improve circulation, and even enhance how your skin appears over those muscles. But most people never reach this point because they're focusing on the wrong solutions. They're chasing quick fixes, creams, or extreme diets, while ignoring the one thing their body is truly asking for. And that's where the real shift begins. Because once you understand what your body actually needs, your approach changes completely. Now, let's talk about something that often gets misunderstood, and in some cases, even ignored completely. Because what I'm about to tell you might surprise you. Your diet could be quietly working against your muscle health, even if you think you're eating healthy. I've seen this happen too many times. People reduce their food intake, cut calories, avoid fats, skip meals, all in an effort to lose weight or stay in shape. And on the surface, it may seem like the right thing to do. But underneath, their body is losing something far more important than fat. It's losing muscle. You see, your body needs adequate protein to maintain and repair muscle tissue. Without it, your body has no choice. It begins to break down existing muscle to meet its needs. And this doesn't just affect your strength. It directly impacts how your arms look and feel. Most people don't realize how little protein they're actually consuming. Especially as appetite changes with age, meals become smaller, less balanced, sometimes rushed or skipped entirely. And over time, the body becomes undernourished in very specific ways. But it's not just protein. Your body also depends on key nutrients like vitamin D, magnesium, and certain antioxidants to support muscle function and skin integrity. When these are lacking, your body struggles to maintain both strength and elasticity. And then there's blood sugar. This is something I pay very close attention to in my patients. Because unstable blood sugar levels can affect your energy, your metabolism, and even your muscle health. Frequent spikes and drops can lead to fatigue, cravings, and reduced motivation to stay active. Over time, this creates a cycle. You feel tired, so you move less. You move less, so you lose more muscle. And as muscle decreases, your body becomes less efficient at handling glucose. It's a gradual shift, but one that can have real consequences if ignored. That's why I often say, your meals are not just about calories, they're about communication. Every time you eat, you're sending signals to your body. Signals about whether to build or break down, to store or to use. And if those signals are inconsistent or incomplete, your body adapts in ways you may not expect. Now, I'm not saying you need a perfect diet. That's not realistic and it's not necessary. But small, intentional changes, like including a source of protein in each meal, staying mindful of balanced nutrition, and avoiding extreme restrictions, can begin to support your body in meaningful ways. Because when your body is properly nourished, it responds. You may start to feel stronger, more stable, more energized, and over time, those subtle changes can reflect in how your arms look, move, and support you. But there's one more piece to this, something deeper, something internal, that many people never consider. And yet, it can influence everything we've talked about so far. There's one more factor I want you to understand. Because it quietly influences everything we've talked about so far, and most people don't even realize it's happening inside their body every single day. It's inflammation. Now, I'm not talking about the kind of inflammation you feel when you have an injury. I'm talking about low-grade, ongoing inflammation, the kind that builds slowly over time, the kind that doesn't cause obvious pain at first, but gradually affects how your body functions. What I'm about to tell you might surprise you. This type of inflammation can be linked to muscle breakdown, slower recovery, and even changes in your skin's appearance. I've seen this happen too many times. Patients come in feeling tired, noticing subtle changes in their body, softer arms, less strength, slower healing. And when we look deeper, there are signs that their body is under constant internal stress. This can be influenced by many things: poor sleep, high stress levels, diets high in processed foods, lack of movement, even long-term blood sugar imbalance. When your body is in this state, it prioritizes survival, not repair. It becomes less efficient at building muscle, less capable of maintaining collagen. And over time, this contributes to the same pattern you've been noticing. Your arms begin to lose their firmness. Your strength doesn't feel the same. Your recovery slows down. And here's the part that really matters. This isn't something you can fix with one single change. It's about your overall lifestyle. I often ask my patients, how well are you truly resting? Not just sleeping for a few hours, but getting deep, restorative sleep. Because during sleep, your body does most of its repair work. This is when muscle recovery happens. This is when important hormones are balanced. And if your sleep is disrupted, even slightly, your body may not be getting the chance to rebuild. Then, there's stress. Chronic stress can increase certain hormones in your body that, over time, may contribute to muscle loss and fat retention. You may not see it immediately, but your body feels it. And slowly, it shows. Now, I'm not saying you need to eliminate all stress or achieve perfect sleep. That's not realistic. But becoming aware of these factors and making small, consistent improvements can begin to shift your body in a healthier direction. Because your body is always responding to how you move, how you eat, how you rest, and how you live. And when you start supporting it from all angles, something powerful begins to happen. You don't just look different, you start to feel different, stronger, more stable, more in control. And that brings us to the most important part of all, what you can begin doing, starting today. Now I want to bring everything together, because by this point, you may be realizing something important. Your arms are not the problem, they're the signal. And what I'm about to tell you might surprise you. You don't need extreme changes to begin supporting your body again. In fact, the most powerful improvements often come from the simplest, most consistent actions. I've seen this happen too many times, in the best way. Patients who felt stuck, discouraged, even a little hopeless. Begin to make small shifts, not overnight transformations, not unrealistic routines, just steady, intentional changes that their body could actually respond to. And over time, things start to feel different. Their arms begin to feel more engaged. Everyday movements feel easier. There's a sense of strength returning, not just physically, but mentally too. It often starts with something as simple as using your arms more intentionally each day. Light resistance movements, controlled, gentle exercises that wake the muscles back up, not to exhaust yourself, but to remind your body that these muscles are still needed. Then comes nourishment, making sure your meals include enough protein to support your muscles, staying mindful of balance, not restriction, giving your body the building blocks it needs to repair and maintain itself, because your body is always listening to what you provide. Hydration, proper rest, managing stress in small, realistic ways. These are not minor details. They are part of the foundation. And here's something I want you to remember. You don't have to do everything perfectly. Even modest improvements, done consistently, can help support muscle tone, improve how your skin appears, and enhance how your body feels overall. But more than that, they give you back a sense of control, because I know how easy it is to feel like your body is changing in ways you don't understand, like things are slipping, slowly, without explanation. But now you know. Most people don't realize what sagging arms can actually represent. They focus on the surface and miss the deeper message. You didn't miss your chance. Your body is still responsive. It's still capable of adapting, and it can still improve when you begin to support it in the right ways. So the next time you look in the mirror, don't just see what's changed. See what your body is asking for. And more importantly, know that you can answer.